everyone. Welcome to another episode of This Week at One Agora. And my name's Chad. I'm here with Dr. Meaghan here at One Agora. And today we're going to talk about functional medicine. So Dr. Meaghan, I get people all the time that tell me, oh, you guys do functional medicine? And they kind of look at me like, that's kind of a fancy word. You know, a lot of people hear functional medicine.
What does it even mean?
Yeah, it sounds fancy, it sounds cool, but a lot of people really don't know what that even means. So what does that mean in your world?
Well, I think what it means is that we're taking a whole different sort of big approach to everything. I mean, when you really look at what we would consider traditional medicine, and a world that I've been into of just the traditional world, is what we're trying to do in traditional medicine across the board is to find that holy grail of a diagnosis. We're trying to find a disease. And everything that we're taught in traditional medicine and how we practice is based on getting to, like I said, that holy grail of a disease. Like you have Alzheimer's, you have MS, you have a sprained ankle. And then from there, then we're able to take that and treat everybody with Alzheimer's the same, because if you have the disease, we have the treatment, but it's based on that diagnosis and it's based on that disease process. So, if you have a sprained ankle, this is how we're going to treat you different than if you have a torn ligament. If you have Alzheimer's, this is how we're going to treat you different than if you have MS. And so sort of that one pill for one ill kind of mentality in traditional medicine. The problem is that, on the spectrum of health and wellness, there are people then that do great with traditional medicine because they fit into that mold that they have a disease, it's diagnosable, and then they have a treatment plan. But the problem is that a lot of us are dealing with dysfunction. And a lot of us are dealing with a type of dysfunction that then we go from doctor to doctor in the traditional world. We can't find that holy grail of a diagnosis or a disease. Right. So then what happens is they're told, oh, it's all in your head, you're okay, or that this isn't anything, like that don't worry, we ruled out Alzheimer's, so your brain changes aren't that, you're okay, goodbye, maybe come back in 3 years. What functional medicine is saying, like, wait, listen, maybe we're using the wrong markers, maybe we have these markers and these ways of treatment that fit the traditional world, but there's this whole other realm of health and wellness of people who are not optimally well, but they might not be in a disease. And then what we have to do is look at function and see how the body's functioning, and then to also try to intercept and support that person before they fall off a cliff, before they get to the place where there is a disease process, but to say, hey, listen, there is this whole world where dysfunction can set in before disease, and we want to actually intercept, change things, figure out what's going on, and provide care at that point.
So it really seems like we're going after the root cause of disease, not just saying, oh, you have pain here, pain there. Let's take this, call me in the morning, or have you go do some PT or someplace or something like that. So we're really, seems like we're looking at everything that could be setting that up, that dis-ease or just pain. Could be low back pain, neck pain, headaches, things like that. In my world, with like the functional PT I do and the training I do with patients, it seems like the whole functional medicine portion of all that is doing lots of assessment, looking to get those answers of why they're in pain, or if they have Alzheimer's or anything like that. And I know with a lot of your patients, you do a lot of blood work. Could be hormones, could be all these different markers. Looking at red blood cells, white blood cells, iron, the whole gamut of
some tests. I use saliva, urine, and stool because that's where you're going to get the answer for what you're looking for. So sometimes you're 100% right that we do more extensive blood work, and I use blood work a lot. But also sometimes with the dysfunction, we've got to look at different markers that are more in the urine, in the stool, or in the saliva.
What would you say as far as in functional medicine, like a percentage or what are or ratio of people that have a lot of gut microbiome imbalances that cause and set up a lot of disease, would you say?
Well, I think it's interesting because I think for as much as we have become the latest and greatest in traditional medicine and in medicine and in the United States, that it's interesting because if you go back to even like Hippocrates, who's the father of medicine, one of his major quotes was, it all begins in the gut. Like everything goes back to the gut. And the more you practice this, the more that you do see that, a lot of things, a vast majority of things do go back to the gut, because that's where a lot of times dysfunction starts to set in. and we don't really know it right away. And so then that can really, things can add up on top of that. Or like, let's say someone gets mold or Lyme disease, it also stresses and puts a huge burden on the gut, and then that connection the gut has to the immune system, the nervous system, and just balancing out the body. That then what happens is that, you know, you have to deal with the problems, the issues, and also get the gut back in order, because it's really hard to rebalance somebody if their gut isn't where it should be.
Right, and I know I've done so many assessments in the rehab for back pain. I know they'll come to see yourself or Dr. Mark or Dr. Heidi for back pain, and sometimes they get better, sometimes they don't. They'll come to see me to get more stability built up in your core and your low back, hips, whatnot. They get a little bit better, and then all of a sudden it's like I have to say, okay, stop, hold the presses, let's look at gut health. And here I find out that they're taking in and eating tons of inflammatory foods, which makes your muscles not act the right way, and it actually adds to their pain in their back. So all of a sudden we have to look at that, clean up the diet, find out what inflammatory things are and get rid of those, you know, and bring in the good stuff for them and figure that out for them. Again, root cause of disease. And we fix that, and all of a sudden, oh, my back pain's 70% better.
Yeah.
Well, there you go.
Well, and how many times too, even like there might be a event, like they might throw out their back snow, like shoveling snow. So there might be an event, and you can get their back 30-40% better, but they don't get better. And then you're great at being like, okay, wait a second. Now, these tissues in the back have healed a little bit, but let's look at this inflammation in the front that's coming from the gut, that's shutting down the core, that's getting you to not stabilize. And so that's the thing about health, is that we really have tried to make it, you know, sort of really unifocus with specialties and with, you know, diagnosis, and saying like, okay, let's put you in this, you know, sort of one area. But the truth is, like, when you really put it all together, it's so multifaceted. And a lot of times then too, when the train comes off the track even a little bit, that you have to look at all these different parts. So even if there's something like you're shoveling snow and that's an event, that then all of a sudden there's these other things you have to address too.
And like you said, all these things you have to address. Functional medicine is not simple. It's not simple.
For the provider or the patient.
Oh yeah.
It's so great to, you know, be able to say, hey, take this pill and call me in the morning, which we're looking at one pathway, and with a medication where they're saying, I'm going to turn this pathway on or turn it off, that's going to affect another pathway because they all work together.
Right.
It's, you know, that's easy, you know, medicine, and it's sort of easy medicine for both the provider and the patient. But really, you know, when you start to get in functional medicine, I posted this meme this weekend, but it's so good. It's like, listen, like, it's really about turning off the TV, getting your thoughts right, getting away from toxic people, drinking water, eating right, exercising, getting your 10,000 steps, like being kind to others, and then call me in 3 weeks.
Right.
And I think that's hard because there is so many wheels in motion for the provider. And I think that's why a lot of providers get a little bit burnt out or can't ever really get started. And it's harder for the patient.
And everyone's different. It seems like no one's got always the same stuff going on.
No, even with same symptoms.
Right. You know, I just love this poster I saw many years ago. I think it was at a different clinic, but it was a poster of an iceberg in the water, and above the water it shows like the tip of the iceberg, and that's maybe can resemble pain. But when you look below the water and it's massive piece of ice below it, that's this dysfunction setting up the pain. But sometimes other doctors are just blind to that. They don't have not really seen that.
Or they're just looking at the tip.
Like you're coming at the tip and say, well, let's take this or put a Band-Aid on it or something.
You're coming in with a headache. Well, let's look at your head. You don't have a tumor. I can't find anything, you know, on any of the blood tests, so you're fine. Well, you still have headaches. You still got the problem. But they're only looking at the tip, so they're not really seeing everything that's underneath the water.
Okay, so all these years I've noticed a lot of people come from out of state, out of town, to, you know, get answers, right? They've been everywhere else and they just haven't got any answers, and they may have heard about us, and they may have heard of the, you know, the word functional medicine, and they want to get answers for what they have got going on. So it's pretty awesome to see people that come here to trust us to get answers for them, so they can put this basically a puzzle together on their health. Right?
Well, and I just think the other benefit, and like I think one of our superpowers, is the team approach. Like, we just have so many people that here that really want to get better, people better, and that shows, but also that they have their own experiences in education And I think all of us like education in the sense that we bring in a lot of different tools and a lot of different information into the care that we give. And so, whether you're seeing myself, you, Trisha, Dr. Mark, Dr. Heidi, like anybody that's here, what we really, I think, do is be able to bring that team aspect, because at the end of the day too, when you look at all of this and put it together, there is a lot of complexity. And so what we can do then and are able to do is be able to break that down for individuals and really be able to help them on their journey.
Right. And, as far as the team approach that you mentioned, and you may talk more about this, but it does seem like we none of us have all the answers,
right.
But we do so much assessment, and you yourself, you do that, myself, Dr. Mark, Dr. Heidi, Trish, whoever. It seems like we're able to bounce that information off of each other and try to find the root cause of this dis-ease that people are having.
And so many times with patients, I tell them, they're coming to me for me to be their backseat driver. Right. I think in medicine, so many times we sort of have this dictatorship where we believe, okay, we're going to go to somebody and they have all the answers and that they're going to tell me what to do, and that's just going to be, the end game. But I always tell people, you're coming to me because I have a lot of experience, education, and we have a great team that wants to get you better, but you've got to take the wheel. You've got to take control of your health. And I can help with education, experience. I've been on this journey with other people to guide you. Right. But ultimately, the other thing too is that I really believe that functional medicine is meant to empower. It's meant to give you back the power, because a lot of times, especially as you go through these disease processes, it also leads to disconnection. You get mad at your body, you get mad that it's let you down, you get mad because this is happening and you don't get the answers. So a perfect example of this, I think, is that what I see from patients that have to go through, unfortunately, cancer. And when individuals, unfortunately are diagnosed with cancer, what happens is a lot of them will even go to a doctor and say, why did this happen? Can I get some answers? Can I, get some idea of what created, breast cancer? And oncology has come a long way. It's very good at even telling you what the receptor is doing. But most likely, if you go to an oncologist and you say, hey, why did this happen? What they're going to say in return is, well, it's just bad luck. This just happens to people sometimes, and this is just bad luck.
Right.
The real hard part about that, though, is that that leaves you as a patient thinking that, okay, even if I, get past this and get into remission, is bad luck going to happen again? Right. Because in our brains, and bad luck is just something that happens. Luck is just something that is beyond our control. We're either going to have good luck or bad luck. But if we can have answers on what pathways are stressed, what has led up to your body not being able to go after these cancer cells and get them under control and get some answers, then all of a sudden it's a whole different kind of treatment too. Of even a lot of times, a lot of our patients will take both a traditional and a functional medicine approach to cancer. But what we, really find is what we're trying to do is get some answers. Right. Not only so that we can also treat underlying causes and root causes, but so that we can also treat that full person and empower them to know why this happened.
Right. So that leads to my next question. So functional medicine is looking at the whole person, trying to get answers, trying to get to the root cause of disease. Is functional medicine also prevention? It's part of it. Mm-hmm. Yeah.
And really, when you look at spectrum of health, everything we do should be to decrease any disease processes or any dysfunction in our body, which also then prevents us and allows us to have an optimal life. And so it really is both. And it really is then, people can come in to say, okay, I want to be as healthy as possible. I mean, we see that a lot in, I think, 52-year-old executives. I see it a lot at 52 for some reason, that you'll get an executive that'll come through the door that's like, listen, I know that there is this thing called mortality now, and I know I can't burn, the candle at both ends, and that, I really want to now support my health because I sort of already have my wealth. And, and then you also see people who are going through cancer treatment and going through chemo and radiation come in and say, well, listen, I want some answers, that I'm not getting in traditional medicine, and to combine both of them. And then you get people who come in who have been told, that it's irritable bowel syndrome, but now they don't have any reason why, or that they're just gonna have to live with it and be on this medication. Or you have somebody who comes in with low back pain, that it's not being treated anywhere else.
Right. And then one thing I have seen of lots of patients have come in that don't really have any issues, but they're here to stay healthy, maybe get some assessment done to, stay ahead of disease, and we go through the numbers with them. They, oh, cool, I'm right where I should be, and they come back for treatments. They might come back for, and we'll talk about this at a different episode, the Quantum Restore program, about getting their bodies mitochondria and energy in their body up to snuff, and to bring things in their body that are disease, prevention, as far as how, what it does to their body, to give them longevity and restore things and things. But yeah, we'll talk about that at a different episode. But I see people come in all the time to prevent disease.
Definitely.
So.
And they say if there's 3 things that we could do to decrease aging, that we wouldn't age if we could do 3 things. 1, support the mitochondria, so that energy pathway, that in each cell we have this little mitochondria, which is like the powerhouse of the cell, which is where we make our currency of energy, ATP. So if we can protect the mitochondria, which does take a big beating when there's Lyme, mold, stress, trauma, pain, any of those things shut down the mitochondria, because the body then isn't about producing energy, it's about just surviving.
Right.
So if we can protect our mitochondria and then also protect our DNA. So the other theory of aging is that the end of our DNA is like the part of a shoestring where it's got that little plastic, and that as we're released to, or as we're exposed to chemical toxins, stress, trauma, all those things, it wears down that component. We sort of start to break down our DNA, and as we break down our DNA, that leads to aging. So if we can protect our mitochondria, our DNA, and keep a healthy immune system.
Okay.
Because ultimately what the immune system is meant to do is to go in and clean up. So it's meant to identify proteins. So it's going to go look for, proteins like strep and other infections and make sure those are under control. But it's also going to look at proteins like your cells and whatnot that are damaged, and to clean those up so that then there's not that stress. So if we can keep a healthy immune system, protect the mitochondria, and not have DNA decrease and sort of be unraveled, then we can beat the system of anti-aging.
Right.
And so that's where too, when you then find out where are these stressors in the body, whether they're physical, chemical, or mental, then what we can do is we can get the body to not break down at a faster rate. So it's very preventative.
Right. Yeah, and in a nutshell, that functional medicine, it is complex, like we've already talked about. There's so many things to it, but we have to start somewhere. When you come in, do an assessment with Dr. Meaghan or myself or Dr. Mark or Dr. Heidi, we're looking for answers. We have our big chalkboard in the back. We put notes on and try to figure out the root cause and what best treatment or therapy would be best for you. So.
And I do want to say too, the complexity is worth it, because
Oh, for sure.
I also think I've a lot of times, sort of related health in your body to gardens. And the thing is that if you don't put in the work if anyone's done, had a garden, whether it's be small or large, if you don't put the work into a garden, it's naturally going to sort of be chaotic.
Right.
It depends on, a lot of things about whether and when it becomes chaotic, when it becomes overgrown with weeds, but it's going to. And we live in an environment where, unfortunately, we're all stressed out because of social media and because of being connected to our phones, and because we all are doing 330,000 things each day. Our food sources are just not as nutritious, but there's also things that they've put into our food that have negative effects. We too, in the last 3 years, like, everybody's at a higher level of stress, fear, and just, confusion.
Right.
And so that's where then too, what you have to do is, and that's why I love functional medicine, because it's empowering. You've got to make the changes. You've got to, but each person sort of has a different starting point. Each person's a different garden. Some people just need to weed.
Yeah.
Some people need to redo their fertilizer. Like, they got to start from scratch.
You need to feed the garden, you need to water it, you need correct sunlight. Yeah, it's hot out there sometimes. Make sure you water your plants.
And it's daily too, because anyone else who has a garden knows. You walk away for like 3 weeks, you go on vacation for 3 weeks, you come back to, okay, your garden's screaming at you, hey, I need more support. So you've really got to, stay on top of it. But it's worth it. Like, would you ever go back and just do plain massage with people?
No.
Why?
Just because there's so much more that's out there that I can assess and help people with, that can affect their whole person, their whole body, physically and mentally, and it's a huge part of health. It's just not the physical. you know,
Yeah.
it's part of it. It can be,
Right.
but yeah, it's, I would not just go back and just do one thing. So.
Yeah, and just do massage, because I think you would feel like you're not serving people the way that you should, because even though you still do some massage and enjoy
doing therapeutic body work is important, but there's so much more to it, you know, whether it be the food they eat, the hydration, or their biomechanics are all screwed up. And, you know, we look at the assessments. That's why we do them, to get those answers. So, but yeah.
Well,
that's a lot of information about functional medicine. I hope you learned and heard some things about functional medicine that makes sense. I know it's kind of evolving and changing for us too. Try and stay on top of it always, it seems like. Everyone's different. It is complex, but it's okay. It's like people come here to get answers, and we start somewhere and we, check the boxes to try to get those answers and set people up for longevity and feeling good, so they can move well, think well, and all those good things in life.
Yeah, and be empowered. Like, this, journey, I think that the more that you know about yourself and the more that you can put these things together, the better.
Right. Well, awesome. That's functional medicine here at One Agora. That's a wrap right now. We'll see you for the next episode of This Week at One Agora. Thanks for watching.